All right. Hi, everyone. Thank you so much for that introduction, and thank you for being here, everyone. Not sure if it's good afternoon or good morning, depending on where you are. It's noon for me, so I'm excited to spend the lunch hour, or wherever you are, the next half hour to 45 minutes, I guess I should say, talking about behavioral changes in our senior pets and how we are going to help manage cognitive dysfunction syndrome. First, we'll talk about what that is, and then we'll get a little more into it from there. But first, let me thank Assisi Animal Health for providing these Webbies. It's pretty awesome to have the opportunity to attend CE or informative sessions, if you will, especially for free. So that's a big, it's huge support from Assisi Animal Health. So again, a huge shout out to everyone on the team at Assisi Animal Health. All right, so we're going to be talking about cognitive dysfunction syndrome and senior pets. And so let's start off with aging in general. We know that aging affects every cell in the body. Even though pets may not be showing outward signs of aging, inside, in every cell, aging is occurring, and older pets' nutritional needs are different. Now, I'm bringing up nutrition because, as you heard, I am a vet tech specialist in nutrition, and I'm going to be talking about a couple of different ways to help manage cognitive dysfunction syndrome, but one of those will be with nutrition. So also with advancing age, there's an increased risk of age-related complications and disorders. And, you know, as you can see on this slide, this includes changes in their organ system. So changes in the kidneys, on the GI tract, certain senses, which are even more important to cats and dogs than, say, humans. And in their appearance, skin and coat may be less elastic. They might be drying out a little bit. And definitely, I see it more so in dogs, but definitely in both species, we also see them going gray, as do humans. And then behaviors, and that's really what we're going to be focused more so on today. The brain is also aging, with effects on mental activities associated with thinking, learning, and memory. And those are associated with changes in behavior, social interactions, as well as activity, and really the pet's everyday habits. So I don't know how many of us actually stop to think, you know, do dogs and cats have or what is their level of cognitive function? You know, this is just a fun, you know, if we thought of what would a dog's brain look like, it would be, yeah, I want to go out, I want to go in. Oh, no, I have to go back out. Oh, no, change my mind, let me in, right? And because that's oftentimes what many of us see in our dogs. They want to go in, they see a squirrel, you know, they're very short attention spans. But we're going to talk a little bit more about that. And then how about in cats? Cats also have quite a bit of cognitive function, and it's more so than what you see on this cartoon, right? This is what we, as just humans, pet owners, think, especially cat pet owners. You know, they're afraid of vacuums. They always go for the people who hate cats, right? There's, you know, they love to go in those areas that they're not supposed to, right? So this is what, you know, just a fun way of thinking of cognitive function in our cats and dogs. But let me take it to a more physiological level. cognition is actually a Latin term from cognito, which is to know. It's really an operation of the mind where we're becoming, you know, I'm talking about humans, obviously, but I'm also talking about dogs and cats in specific, or specifically dogs and cats. So we become aware of objects of thought or perception. That's what cognition is. It's really all aspects of perceiving, thinking, and remembering. And let me give you an example of cognition in pets. When I take my dogs out for a walk or out for a ride, they have different harnesses and leashes to go to those different places. If I get the harness ready to go out for a walk, they know exactly, once I open that drawer, get that harness out, they know exactly where we're going. Now, if I were to get the other harness out, they would get very excited because they love to go for RIDEs. I have two of my dogs in the office with me, so I don't want to say it, but they know that specific harness goes into the vehicle, so they're going for an RIDE. So they truly are, using their cognitive function. They're able to perceive and remember which harness goes where. Now that's just a small, easy example. I'm sure we can come up with many, many more, but just to show you that, yes, dogs and cats do perceive, think, remember. So with aging, we mentioned a number of different organs, and when we start talking about organs and then behavior, we're going to start talking about brain aging. We know that brain function declines with age, cognitive abilities worsen. There's a decline in brain function mainly due to tissue and behavioral changes, and I'll show you a visual of that coming up. And the underlying cause oftentimes is over the course of a life, be it whether you're human or I guess mammals in general, okay? The underlying cause is oxidative damage from toxic free radicals. So you're like, what? We're gonna get into this, don't worry. But first, let me show you about what I was talking about as far as brain tissue. So if you were to look at this MRI cross-section on the screen, this is a dog with a healthy older dog with a healthy older dog brain. Okay, you can see on the left-hand side, the cortex is healthy in appearance. The ventricle size, so we're looking at the normal size of the lateral ventricle, but if you look at both ventricles, they're normal size, they're looking healthy. So how do we know that that's normal? Because here's an older dog with obviously this dog's brain has some damage. The cortex has shrunken, okay, it's atrophied. We see an increased size, and now you can see a better comparison, increased size of the lateral ventricle. Okay, so with this kind of damage, that is pushing away, taking away from brain tissue. So the dog won't be able to function and their cognitive abilities worsen. So when we're talking about and looking at brain changes with aging, obviously then we want to maintain optimal nutrition. What is going to help that pet overall with all organs but specifically with their brain function. We want to manage any risk factors, especially inflammation. Okay, there's a great deal of inflammation, as you saw in that prior MRI. And there's inflammation throughout the body, but there's definitely inflammation occurring within that brain tissue. So we want to provide as much as possible therapies, management to help improve the quality of that senior pet's life and the length of that senior pet's life as much as we can. So oftentimes there are specific signs that we in the vet profession, and probably you as shelter workers know, you probably know to look for certain signs. And really, when we're talking to pet owners, we want them to start thinking about the thinking behavior in their pets, okay? Activity level in their pets. What kind of interactions are they having? Has there been any loss of control? And sleep-wake cycle. So this actually, the acronym is TAILS, thinking, activity, interactions, loss of control, and sleep-wake cycle. So that's one way to remember these signs that we should be looking for. And so let's go back. Thinking, the pet is now confused by, ordinary things or some similar surroundings. Activity, seems like naps have become more appealing than playing or going for a walk. And if we're talking about interactions, the pet isn't really socializing with you or with their fellow pets as much as they used to. Loss of control. Your pet is, typically well-trained, and now they're starting to have more accidents, forget to go to the door to go out. And oftentimes this is one of the reasons that pets, especially senior pets, will be relinquished to shelters or to rescues. And then the sleep-wake cycle. The sleeping patterns for cats and dogs have changed, and they're more awake during the night, or, it's changed, it's flipped. There's a lot of vocalization oftentimes, especially with cats, because they're not understanding, they're not truly thinking and perceiving how they once did, even in similar surroundings. So that's one way, especially for our pet owners, to understand. The one that I'm most familiar with that we use oftentimes in the veterinary hospital is called Disha. And it's similar, right? We're still looking at disorientation, interactions with pets and people and how those have changed. That sleep-wake pattern has been disrupted. House soiling, and then activity changes. So there's two different ways, two different scales, if you will, TAILS or Disha. All right, so what those two scales are, or acronyms really, are telling us is certain symptoms that pet owners may or may not notice. Some of the time, pet owners don't really think that there's an issue. They just attribute what's going on to old age. Well, you may have heard me say before, and other individuals say, old age is not a disease. So, if the pet is getting confused and maybe goes to the wrong door, maybe goes to the wrong side of the door. That's very common with cognitive dysfunction syndrome. It gets worse when, they're not recognizing their owner anymore. Maybe they're barking at night for no reason, or with cats, they're vocalizing. They're sleeping more, they're not as active, maybe not running to greet the family. just kind of wandering around the house like they don't know where they are after they've been, raised in this environment. And then accidents, having more accidents indoor, or maybe for cats, maybe they're inappropriately urinating where, they've always used the litter box. So, So definitely signs to look for when we're talking to pet owners. So here's just some more visuals, better than I can describe them. On the left-hand side is a small dog who is confused and, is hanging out under a chair, but doesn't really know the difference between that being under a chair or being, in the living area with the family. Same dog going to the wrong side of the door is the next one over. And another dog not quite knowing where he is or she is, and again, going to the wrong door. And then oftentimes with cognitive dysfunction patients, they're also very anxious. And, think of that with humans as well, or related to humans, right? As older people start to lose their, maybe their true cognition, it makes them nervous, right? Maybe they can't bring a word that has always come easily to them to the forefront, and they start to get, a little stressed about that. The same is true with our cats and dogs. Dogs that, they recognize that something isn't right. They don't know what that is, but they become then more anxious. So what about with our cats? Well, as I mentioned, increased vocalization, checking out the litter box, but not using it appropriately. And then they start to go elsewhere just because they have forgotten where they're supposed to go. Now, obviously with cats and dogs that are seniors, we're gonna have to rule out other disease conditions that could potentially be going on. But what I am bringing this up to you as, individuals that work in shelters and rescues is one thing that we should keep in mind is it could be cognitive dysfunction syndrome that is causing the pet to eliminate elsewhere. And then hiding, right? They're not familiar with their surroundings, or something seems off. So what are cats going to do? They're going to hide. So memory impairment in pets across the US, there's actually more than 28 million pets in the US with some type or some level of memory impairment. 40% of dogs over 15 years old have at least one symptom, and 50% of cats over 15 years old have at least one symptom. So a survey was done asking pet owners about, and Disha, actually the acronym DISHA was used in this survey. And what was shown was 75% exhibit at least one of those Disha signs. 37% observe one or more of those signs at least several times a week. Now, this is from pet owners after they've been educated about what the Disha acronym stands for. 32%, so a third, reported 3 or more signs. But the disturbing thing here is only 12% have talked with, any member of their veterinary team. So once we educate them, or maybe I should say, as we need to start educating them earlier and encourage and allow them to to share what's going on with their pet at home. And that's up to us as veterinary healthcare team members. And I would say, you know, it probably relates to you as shelter and rescue employees as well. We need to, and I'm not saying that anyone on this call doesn't, you guys probably all are doing this, but we need to get our colleagues across the US asking more questions, listening, and educating about these different disease conditions. So in cats, as I said, 50% that are 15 years or over have at least one sign of cognitive dysfunction. And if we go back a little bit, between 11 and 14 years old, 28% of them have at least one sign of cognitive dysfunction. And as I mentioned earlier, we really need to continue to have discussions, because symptoms of cognitive dysfunction syndrome oftentimes will mimic those of other diseases that are common in senior cats. Feline lower urinary tract disease is one of them. So now I showed you the visual of the brain tissue. And so what exactly is happening? So the brain, the tissue within the brain is very active, and it has high metabolic activity. It actually, the weight of the brain is only 8% of the whole body, but it consumes 20%. It uses 20% of body oxygen. It naturally contains protective antioxidants, and it also has limited regenerative capabilities. So free radicals are actually damaging brain tissue. It's actually damaging many tissues throughout the body. But when we're talking about cognitive dysfunction syndrome and brain activity, endogenous, so from our own or from their own mitochondria, which the powerhouse of the cell, those free radicals are coming from their own mitochondria, okay? In addition to that, pollutants, radiation, carcinogens, and a whole host of other things within the environment are causing damage and creating an increase in free radicals within the pet's body, within our own bodies as well. So free radicals produce energy. And, the cell, obviously the mitochondria within the cell produce energy. That is going to generate free radicals as byproducts. So I mentioned that we do have antioxidant defenses built within us, but they are decreasing with age. So as the mitochondria age, and let me bring up a visual that will help with this. As those mitochondria age, they're not producing as much energy, which is what the body needs. They're producing more free radicals, which is, the mitochondria are less efficient and is going to eventually lead to death of the cell. So imagine this happening. These brain cells are becoming damaged and dying off because of the damage to the mitochondria within each cell of the brain. And I know this is getting like, you guys are like, oh gosh, we're going back to biology and blah, blah, blah. Just bear with me for a little bit longer and you'll see where I'm going with this. Well, now you see where I'm going with this. So what I am excited about, nutritionally speaking, is that we can help brain aging through nutrition, because scientists have come up with certain nutrients that are what are called mitochondrial cofactors, which are going to help those mitochondria that we were just talking about improve their efficiency, decrease that free radical production that is doing so much damage. And then with antioxidants that we add or that are within the foods, that will result in decreased damage. So decreased production of free radicals, increased antioxidant defenses will enhance the mitochondria and make them, again, more efficient. Hopefully that makes sense. And you see where I was going with the free radicals and all that boring stuff, and then bam, we're into to nutrition and how that's going to help. Okay, so antioxidants, you guys know them as well as I do. In human nutrition, antioxidants are so popular, right? So vitamin E, vitamin C, selenium. Selenium is essential for beneficial antioxidant enzymes. Beta carotene scavenges, so it goes after those free radicals, and all of these act synergistically. So if we have these within a nutritional formulation, then they act together, they work together to go after those free radicals, and thus antioxidants. We're going to talk about some of the other things as well that are on this slide. So if we can have antioxidants and mitochondrial cofactors within nutrition or added to nutrition, then we are going to be able to, again, multimodal approach, but we are going to be able to help alleviate some of that cognitive dysfunction. And again, you see it on here. We talked about the vitamins, beta carotene, but also lipoic acid, L-carnitine, and then fruits and vegetables. And we get carotenoids and flavonoids from fruits and vegetables. And they also help to, for lack of a better way of saying it, attack those free radicals. So antioxidants work in concert with each other to help quench free radicals. And lipoic acid and carnitine are going to help support efficient energy production to generate fewer free radicals. So I'm hoping now that you can see how I was talking about the damage and how nutrition or certain nutrients, such as, the antioxidants and lipoic acid, are going to help improve that brain function. Carotenoids and flavonoids, as I said, those are additional antioxidant defenses that we get from fruits and vegetables. And, we know, I think most people know where antioxidants come from. And it's not so much that pet food manufacturers or anyone really is just throwing in, fruits and vegetables. They're actually getting the nutrients from those fruit and vegetables and putting them into the formulation, some of these you can supplement as well. DHA and EPA, omega-3 fatty acids. Remember we talked about inflammation. DHA and EPA are anti-inflammatories, and they're omega-3 fatty acids that are going to help decrease the inflammation and help to nourish that brain tissue. So don't worry, I'm not gonna get into genetics, but we have seen changes at the gene level that affect key metabolic pathways and body functions. So gene expression does change as pets age. Some genes have increased expression and some genes have decreased expression. And you don't really need to get into that. I just want you to remember that those gene changes, as I say here, affect key metabolic pathways and body function, including oxidative stress and free radicals, which we've been talking about, antioxidants, the inflammatory process, and immune function. Aging is a process, as we know, that brings about significant oxidation and inflammation. That's what we've been talking about. And those two things are at the root of many conditions associated with aging. Adding antioxidants to the diet help to reduce the formation of free radicals and protect against many age-related health issues or conditions by preventing those free radicals from damaging the cells, because that cell damage then leads to inflammation, and it's a vicious cycle. So we need to increase awareness that even though aging is unavoidable, age-appropriate nutrition can play a part in fighting the effects of aging in pets. It can help with both the visible changes, such as the skin and coat or maybe muscle atrophy, and those that maybe aren't as noticeable, such as the immune system and behavior or cognitive dysfunction. So I mentioned that I was going to be talking about how nutrition plays a role in this, but I also mentioned that there's another therapy that we can utilize to help manage cognitive dysfunction and decrease that inflammation. We know that, you guys know that, as the Assisi Loop. And so you can see some visuals here. I have some more on the next slide, but as you guys know, the Assisi Loop is based on pulsed electromagnetic field therapy, which is delivering a signal tuned specifically to minimize pain and accelerate healing. And I love this for the different disease conditions because it's stimulating the pet's own natural anti-inflammatory process, while in conjunction is healing the tissues. And the mode of action, the mechanism of action, is that it upregulates the production of endogenous nitric oxide. Nitric oxide is the body's own anti-inflammatory molecule. So you see here some of the different ways, different size loops and how they can be utilized to help dogs and cats. You know, you guys, it's going to be up to you and your veterinarians to help with your individual patients. But, you know, here we have like the halo, if they need an Elizabethan collar, it can be affixed to that. It works in cats as well. So this is another great modality that we can use in conjunction with nutrition to help these guys maintain what brain function they have left, and maybe even you know, get some of it back. There's limited regenerative capabilities, but we can kind of stem that tide and help them live a little bit longer and, in the eyes of the owner, a little bit better. So we know the benefits of therapy here. Improves circulation, accelerates healing, reduces swelling. Remember, it's an anti-inflammatory, which I love. I love that it, you know, that it helps to decrease inflammation, because it has a role in so many different disorders, but especially with the inflammation associated with cognitive dysfunction syndrome. So we've talked about the signs of aging and what our pet owners may be talking to any of us about. And again, that is activities or behaviors that fall under thinking, activity, interactions, loss of control, and alterations in the sleep-wake cycle. Oh, sorry, I should have been doing that while I was telling you. So how are we going to manage cognitive dysfunction? We're going to maintain that optimal nutrition. So we want, you know, a senior pet food, because as long as they are senior pets, we want the right nutritional life stage. And we are also going to manage inflammation with certain nutrients and with the Assisi Loop. And because what we're trying to do is allow improvement in the quality and the length, the quality of life and the length of life in those pets. What we're trying to do is fight the effects of aging. And we just talked about 2 ways to do that.